All right, well, hello everyone. My name is Katelyn Proctor and I am the founder of PT Exam Prep. I'm going to be talking to you today about what you should be doing while waiting for your written results. I know it's a stressful time when you're waiting for these results to come out, but you have about 18 days before those results come out. So we want to make sure that you're getting the most of this time, okay? So that's what we will be going over today. I'm going to be explaining some tips and tricks and some topics that you must go over during this time because they will be important to you no matter if you're taking the written or the practical. Okay, so first, just to explain to you who I am, I know I see a lot of familiar faces here. So I think a lot of you guys are registered in our courses, whether it be the written or the practical. But to explain a little bit who I am the founder of PT Exam Prep. We started around 6 years ago and are proud to say that we're the most comprehensive prep program in Canada for physiotherapists preparing for their exam. I'm a Canadian trained physiotherapist along with all of our teachers. They are all Canadian trained physiotherapists. I apologize for anyone who is internationally trained and does apply for a position with us. And you know, we write you back saying, unfortunately, we can't bring you on, but it's just because we want to make sure that we're providing you with all the best tips and tricks that the Canadian schools give. So that means we only do allow teachers to teach if they've gone through the Canadian training program. I work in orthopedics and of course, as well as PT Exam Prep, but really I want to get to know you guys. So I'm going to just ask you 2 questions here. You're going to see them pop up onto your screen. And the first question is, when did you write your exam? So this question should pop up onto your screen right now. I'm assuming a lot of you guys will probably be in that, you know, March, May, July group. It looks like right now a lot of you guys are in the July group. Okay, so I'm going to get a few more people voting here. We only have about 60% of you voted. I have this really cool little tool in GoToTraining that lets me see when people aren't on the screen. So yeah, just try if you can to pay attention just for this first little bit. I'm going to give you lots of good information. I promise it will be worth your time. Okay, I'm going to close this here. In 5, 4, last votes in 3, 2, 1. Okay, I'm going to show you guys those results so you can see. Some of you haven't written the exam. Looks like the rest, mostly July, and we do have a few other ones. Okay. Again, this is totally confidential. No one can see what you did vote for. The next question I'm going to ask you is, which practical exam are you planning to take? Now, this is really important because it's going to let me know as a group, are we talking to people who are kind of months away from the exam, a year away from the exam? So please let me know. Good, lots more people voting this time. So give you about 10 more seconds. Good, 5 more seconds. I appreciate that you may not have an option to press with this, but it looks like we have most people who have voted. So this is awesome. I'm going to share that with you guys. And you can see most of you guys are writing in November, then June, then November. Okay, so that's really, really helpful for me to know. So let's get going with this material then. So my first thing that I really want to make sure that you guys know is that you want to review topics that you remember being on the exam. Now this is a tricky one because of course the exam is extremely confidential. You do not want to share anything that was on the exam with other students. However, it's okay for you to go over those yourself. So are there topics that you remember finding hard? For me, I always remember that carpal tunnel was really difficult for me. So what you want to do is you want to write down all those topics if you can. Make a list. Try to brainstorm as many as possible. You know, everyone leaves the exam having a few questions that they're like, oh my gosh, I can't believe they asked that. Or, oh my gosh, that was so difficult. So write those down. If you don't remember much, so say you're more in that group of people who wrote in March or May or maybe July, but you just blacked it all out. That's kind of what I do. You know, try doing a few mock exams and see if any questions come up that you're like, yes, I remember that being being on the exam, and just make a note of that. So you want to create a list and try to find something that triggers your memory, okay? From those, you want to make it a priority to review those. What better things to review than things that you know were on the exam? Regardless of if you're doing the written or the practical, it's very important to go over those topics that you did find difficult, because clearly they didn't stick, and you need to relearn them, if you will. So what I want to do for you today is I want to go over the topics that I think are must-know topics, okay? Regardless of whether, again, you're doing the written or the practical, these are things you must know. So what we're going to cover today is joint mobilizations, COPD, brachial plexus, and infection transmission. So these are topics that I think are super important regardless of what exam you're taking. And then suggested topics that I would say that you add to your list: gait cycle, special tests, contraindications, and red flags. So a few things with this. For the gait cycle, you do want to know which phases and which kind of muscles are activated during which phases. Really important for you to know, again, for both exams. For special tests, remember this is an entry-level exam, so we're looking for basic tests, okay? We want to see that you know how to test something for the supraspinatus muscle. We want to see that you know the lateral epicondylasia tests, all right? Those are very basic. If you're not sure which ones are basic and which ones aren't, that's tough. That's when the courses definitely come in to funnel down what things you need to know. But for those of you that are here that are registered in the written or practical course, you know, we give you a good concise list of those exams that we think that you need to know for special tests. So make sure you know them, okay? Contraindications, make yourself a little Bible of contraindications. Really important to memorize those, again, for both exams. Written, it's almost a little easier because you can kind of take your time and go through the questions, versus in the practical exam, you need to be able to verbally state them really quick. So some of them we'll go over today with the joint mobilization, so I can show you what that means. And of course, red flags, mandatory questions. You definitely need to know these for your subjective exam questions in the practical. For written, there are a lot of scenario-based questions, so of course those are going to help you with that too. So we're going to get right into it today, and we're going to be talking about my first must-know topic, and that is joint mobilizations. So first of all, you really want to know your indications, your precautions, and your contraindications. Okay, so in the chat box, you're going to see that you actually have the ability to chat back with me here. I'm saying that, but I'm thinking you actually might only be able to answer questions. Okay, we're gonna try this. So do you guys know any precautions for joint mobilizations? If you do, please write them in the chat box. If you can't see the chat box, just type it as a question. That's awesome. Yeah, perfect. I see you guys typing them as questions. Yes, awesome. Good, 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 good. So again, remember, I'm wanting here to go over precautions, okay? So not contraindications, precautions. Good. Thanks. A lot of you guys are writing some good stuff. Keep going if you can. Okay, so here's what I'm going to tell you guys. Indications are very important. They're very important for the written because they're going to say, you know, why should you do this? And they may trip you up a little bit. So we want to do this when we have decreased passive movement, okay? If they have decreased active motion, but normal passive motion, then we wouldn't do it, right? So you want to make sure that it has decreased passive movement. For other indications, we want to go with early capsular end feel. So if you guys have printed these notes out, put a little star here and remember all of your end feels, okay? Again, so important in the written because they can trip you up with these very easily. And with the practical, you may have to state, you know, what is a normal end feel you'd expect to feel in the knee versus the shoulder? You know, what type of end feel would you expect to see in an arthritic knee? All right, and that early capsular end feel is what we're usually seeing, and that's an indication for joint mobilizations. Next is mechanical pain. Mechanical pain is a great indication for doing it too because it causes those mechanoreceptors to get the feedback and it allows some of those muscles to just relax afterwards, okay? So again, a good indication which is important to know again for both exams. So we're going to go into precautions. Now precautions here are a tricky one. Precautions are things that are going to make you stop and think. Precautions are something that are very important in the written exam because you need to know when something is completely contraindicated versus when something is that you want to be precautious about. So for example, someone may have impaired circulation or sensation. This would be something that you want to stop and think, should I be doing this? That doesn't mean that you can't do it. So on the written exam, again, very important to know your precautions versus on the practical exam, you really want to know your contraindications. So I'm going to just pop up the contraindications here as well. We're going to talk a little bit more. Okay, so if you did not pass your written exam, you will need to take that written exam again. If you do pass your written exam, you will be going on to take that practical exam. Regardless of which exam you are taking, you will need to know these three things: indications, precautions, contraindications. So make a big highlighted star on this and make sure you memorize this slide, okay? Awesome. So I have someone just saying that they can't hear me. I would just increase your volume. I think everyone else can hear me. Put your hand up if you can't hear me. Okay, perfect, you can now. All right, so going back to this, again, make sure you know both of them. Okay, we're gonna go a little bit more in depth with COPD now, okay? So these are the things I think that you should know regardless, all right? So presentation, what does COPD look like, right? Diagnostic criteria, what is needed to diagnose COPD? Treatment and home exercise program, HEP means home exercise program. That's saying, what would you give this patient to work on? And systemic consequences are things that could go wrong with it. Okay, so let's look at the first one, presentation. Now, for example, on the written exam, it may give you a case scenario that's asking you, which person is this? Is this an emphysemic patient or is this a chronic bronchitis patient? In the practical exam, they may say to you, explain to the patient their pathology. And they may have one or the other. So again, a really hot topic for both exams. So make sure you know this, okay? So I just want to talk a little bit about this. Emphysema, we're dealing with permanent and destructive enlargement of the air spaces. Now again, these are further down or distal to those terminal bronchioles. And we're not seeing that obvious fibrosis or that loss with the normal architecture. We call these people pink puffers, all right? Versus chronic bronchitis, we're seeing the presence of a cough with productive sputum that's not attributable to other causes. On most days, for at least 3 months over 2 consecutive years. Now, again, highlight this, star this, make this important to both people who are writing this exam, again, written or practical. You need to know that it's on most days for at least 3 months over 2 consecutive years, all right? If you have a subjective question in either of those exams, written or practical, this will somehow come up most likely. So make sure you're able to say 3 months over 2 consecutive years. So again, highlight, star that, make sure you know that. Now we're going to go on to diagnostic criteria. So for the diagnostic criteria, I want you guys to know the lung volumes and capacities, and I want you to know whether they are increased or decreased in COPD. So for example, our forced expiratory volume for 1 second, also known as FEV1, is decreased in COPD. Now remember, why is it decreased? Think to yourself right now, why is it decreased? There's a reason we give these people pursed breathing, and that's because they retain all this air, right? They're hyperinflated. So they can't seem to get that air out. If they do pursed breathing and get that positive end pressure to push open those alveoli, you will then see that that air can come out. So they can get it out in time if we were to look at the total volume, but it's still lower than the normal population, and it's definitely lower in that 1 second. So again, FEV1, FVC ratio is also lower, but their total lung capacity, remember they're hyperinflated, is increased. So TLC is increased. And again, residual capacity, because this air gets trapped, it's also increased. Okay, so I want everyone to try this with me. I'm going to explain it, and I always end up doing it as I explain it, and it's hard then to hear me. But what I want everyone to do is I want you all to take in a really big breath. So super big breath, okay? Hold your breath there. Hold your breath there, okay? No one let it go. From here, I want you just to take a small breath in and a small breath out. Small breath in and a small breath out. Okay, keep going. 3 or 4 more of those. Small breath in, small breath out. Small breath in, small breath out. Okay, let it all go. Hopefully no one passed out on me. So what you just experienced is the work of breathing with someone with COPD. You are hyperinflated, so you take that big breath in, and then you're trying to breathe at that kind of huge lung capacity there, right? And it's hard to breathe. There's a lot more work of breathing. It becomes that tiresome breathing. So that's what it's like in COPD. They have all this air stuck in their alveoli, so they're hyperinflated, and they're breathing at this tidal volume. See someone's hand up here. If someone does have a question, type it into the question box, and I will do my best to answer it whenever I can. But I hope that makes sense to you. So think about that, when you're on your exam. Again, whether it be written, you want to know these ratios very, very in and out, because they're going to ask you these fine-tuned questions. On the practical, you still need to know these, and these could be great 5 by 5 minute stations. So again, those follow-up stations after you've just done your clinical interaction. Another reason why this is important is because you may have to explain to a patient what COPD is in layman's terms. Okay, so it's a great way to explain it using that hyperinflated analogy, taking that big breath in and having that smaller tidal volume at the very top. Okay, so I hope that makes sense to you guys. Gives you a little bit more of a visual way of working through it. So treatment in a home exercise plan, we kind of talked about this a little bit. The best treatment to give them the best treatment to give them is exercise. The best treatment to give them, is to get moving for sure. Smoking cessation, super important. Inhaled corticosteroids, really important. Oxygen supplementation outside of our scope. So that's a good question for ethics, whether it be on the practical or written. If it's written, oxygen supplementation is okay. If it's been prescribed to them, we can then explain to them how to use it, offer that to help them. In the practical exam, the examiner may say to you at 8 minutes, can you please offer this patient oxygen supplementation? Can you? Can't you? How would you respond to this? So these are the things you need to know regardless of each exam. If I were in that practical station, I would want to know, have they already been prescribed it? Do they know how to use it? Okay, that shows that you're safe. That shows that you have a proper understanding of the ethical considerations with that question. Okay, so that's how you need to change your mind when you're studying in this in-between time right now. How is this important for the written, and how is this important for the practical? All right, home exercise program. The one thing I hope you give all your patients with COPD is that pursed lip breathing. And again, that's to give that positive end pressure to those alveoli, pop them open, hold them open longer, and get all that air out so they don't stay hyperinflated. Okay, we're going to keep moving on here, and I'm going to give you guys some questions that I want you to look at. So students who are in our current course, you will recognize this, okay? So are the following increased or decreased? These are systemic consequences. So I'm going to give you guys 1 minute here. I want you to write down whether or not these are increased or decreased, all right? And then we're going to review this. So 1 minute here. Right, about 10 more seconds. Okay, looks like most of you guys have been kind of typing some of these questions in, but let's go over them, all right? So again, this is easy. This is super, super easy. So I hope you guys all know this. Or most of you have done this exam, so this should be quick. All right, so VO2 max, what's going to happen with VO2 max? Well, we know it's going to be decreased. They can't contain that air, and they can't control that air as well. So then we look at something like osteoporosis. We know that that is increased, and that is due to those corticosteroids. Depression, we know quality of life scores decrease in this population, so it is going to be increased. Muscle force, we know, is decreased. Cardiovascular disease is, of course, increased, and feelings of fatigue is also increased. So here's how I want you to study, okay? For the written, you would take this information and you would understand, not just memorize, but understand it. For the practical, you would again want to be able to understand this, but you'd want to be able to explain it. Okay, so that's how we're taking that written knowledge and transferring it to the practicals. You need to be able to explain this to your patients. Okay, why is VO2 max decreased? Why is osteoporosis risk increased? Depression, why is this increased, and how would you be able to assess this? So which outcome measure would you use to assess this? Okay, so really trying to get your brain thinking deeper into these questions, all right? Studying for the practical is one of the best ways to study for your written exam. So no time is wasted right now. If you are studying for your practical, you are not wasting a single moment of time if you do fail your written and have to retake it. This is just a new way to look at the question. So I highly, highly encourage you, start studying like you're studying for the practical. Okay. So I'm going to give you a little bit of homework here, okay? So those are those answers. They're on your slides there. I'm going to give you some homework. I'm not giving you the answers, please. If you want to email me the answers, I will give you the right answers. But we want to look at what is respiratory rate doing in COPD? Heart rate, O2 sats, ABGs, physical appearance, respiratory sounds. Again, very, very important. For the written exam, they may ask you questions specifically from this. For the practical exam, you may have questions like an auscultation station, and you'd want to know in your inspection, am I expecting the respiratory rate to be increased or decreased? In the heart rate, am I expecting it to be increased or decreased? Now, we expect that respiratory rate to be increased. Remember when we all did that big breath in and we tried to breathe? You're not taking deep breaths, you're taking smaller breaths in, which is going to increase your respiratory rate. So you need to be able to know this for the practical, because you may have to report what would you expect to hear with this patient, okay? They're not going to have a patient there with COPD. Well, they may, but it's not going to be on purpose. But they are going to standardize it across Canada by saying, what would you expect to see in this person? Okay? So again, email me your answers. My email is at the very end of this presentation. It's info@ptexamprep.ca, and I will give you those answers, but just some homework for you, okay? Next, we're going to go into the lovely brachial plexus. Now, this is something that all students need to know. Very, very applicable for the written exam. Not so applicable for the practical, but definite possibility for that 5x5 follow-up station. You may have to show an exercise prescription for, say, something like, let's go with, trying to think of a good muscle that could go with, triceps. Say you're having to show an exercise for this. It may say, well, what nerve innervates the triceps? What nerve roots innervate, the triceps? Which trunks are composed of the radial nerve? So these are really, really important to know. It's simple. It's simple to memorize this. There are 1,000,001 videos online that explain good little tricks and tips, but I've included this in your handouts. So please download it, memorize it. I always like to get a little whiteboard, get a nice color, and just practice drawing this out. Erase it, practice drawing it out. You should be able to draw this out in no more than 45 seconds to a minute. And every single one of you guys right now should be able to do this, regardless of if it's for the written or the practical exam. If you fail your written, very, very important to know this. If you go on to pass your written and you're going on to the practical, I'm going to say medium level importance, but it's something you can be doing right now. Okay, so let's go on to the next one. This is infection transmission, a big hot topic these days, okay? Infection transmission, we have different precautions. We have standard precautions, contact, droplet, and airborne. Standard precautions are going to be for things like HIV, Hep B, and Hep C. You could have a question on the exam that's asking you to use the proper infection transmission for a patient with HIV. Okay, if you go into the room and you gown up and mask up and goggle up, you're completely incorrect. Your patient interaction score is going to be so low that you will fail that station. because there are no precautions that are needed with these people other than just the standard precautions that you would use with any other person, like washing your hands. So very important for both the written and practical exam again. So make sure you are studying this right now. Make use of this in between time to memorize your infection transmission precautions. So I've given you guys a little list here. You can review these on your own time. But the big ones that I want to kind of chat with you a little bit about is through giving you an example station. So I'm going to show you how, if I were you, I would be studying. So take infection transmission. I want you to make an example station up. What do you think they could ask you? I also want you to make a vignette style question up for it. And you will see how even studying for the practical right now will help you with your written, okay? So an example station I'm going to give you. So your cystic fibrosis patient has MRSA and you have been asked to perform chest therapy. Display to the examiner how you would don and doff the appropriate equipment. You are not required to get consent. Okay, so I want you to think about this for a second. I'm going to give you about 30 seconds or so to just think through what you would do in this station. So for those of you that are listening right now that are lost and are not sure what to do, we give you a very structured approach to going through these stations in our practical course, but I want to give you an example here. So what I would first be doing is saying, MRSA, what am I doing with them? I am performing chest therapy, so I'm doing bronchial hygiene. Which precautions would I want to follow with them? From there, how am I going to go through those steps to correctly bang out the station and get every mark possible? All right, so since this patient has MRSA, you would normally not wear a mask, okay? So if we go back to here and we take a look at our precautions, we would normally say that we would be dealing with contact precautions, but we are gonna have to go to droplet precautions because we are dealing with bronchial hygiene. Okay, very important. A great way to trip you up is by saying that you need to do bronchial hygiene on any patient. You are then going to go into droplet precautions. So since you are performing this chest therapy or bronchial hygiene, a mask and goggles are also required, droplet precautions. Okay. One of the things that I really want you to think about here is that the room will most likely not have a sink. I would say 9 times out of 10, this room is not going to have a sink. So when you're going through your steps of getting ready to see this patient, you are going to use hand sanitizer. You're not going to say, I would be washing my hands. You are literally going to use hand sanitizer, okay? So let's go through what we would show our students to do. So droplet precautions, donning, all right? You would go in, you would wash your hands. You would put the gown on. You would then put your mask on. We're looking for a surgical mask here, not an N95 mask. Those are used for airborne precautions. You would then form the nose strap over your nose. You would place the ear loops or ties around your ears, and you would pull the bottom of the mask over your chin. You will not get full marks if you do not put it on exactly like this. So form the soft nose metal strip around your nose, then put it over your ears, then place it over your chin. Okay, so again, very, very step by step, we're going to give you how to do this. Then you're going to put goggles on. Normal eyeglasses are not enough, okay? We've had people before get tripped up about this. You need to put goggles on. And last, you're going to put gloves on. If they have beard covers, you would place this, if you have a beard, you would place the cover on when you're donning your mask, okay? Terrible, terrible, embarrassing for me to tell you guys this right now, but when I was a student and I did this exam, I put the beard cover on my head. I thought it was a little head cover, super embarrassing. But, the correct thing to do is it is a beard cover, not a head cover. Don't make yourself look like an idiot like me, and go through these exact steps. Now you're going to doff all these. What are you going to do? You're going to take off your gloves first. We have a video that we show in our course of the proper way to take off your gloves. This is a really important way so that you're not spreading infection, okay? Next is hand hygiene. Use the hand sanitizer, wash your hands, then take the gown off. Again, really important that you fold it inside out as you're taking it off, then wash your hands. Then you're gonna take off the mask and eyewear from the back. Do not touch the front of the mask or eye protection. If you do, that's a fail. Really important. So this is why you have to pay attention to those small little things. If you want to get help with this, this is why courses are so important, because you can have everything right in the station, but then you go and touch the front of the mask or gloves or goggles. And then again, you're going to wash your hands. So if we're looking at doffing, you are using that hand sanitizer 3 times. If you do not, that is a safety fail. So really, really important. Something you should be memorizing for the written and for the practical. So I'm going to give you an example of a vignette style question, and I'm going to show you why studying for the practical is so important right now in this in-between time, okay? You don't need to study like you're studying for the written. You want to move on and study for the practical. That's going to help you out. So again, we're going to say your cystic fibrosis patient has MRSA. She has difficulty breathing after 1 to 2 minutes of secretion clearance techniques. Her skin is bruised and sore from her last treatment. So that's your vignette. Your question is, you have been asked to perform chest therapy. What is the proper donning and doffing technique for this patient? Now, I hope all of you guys know this after what we just went over, okay? This patient has MRSA. You are going to be teaching her secretion clearance techniques, which is bronchial hygiene. So your answer better be droplet precautions, right? Okay, I hope that makes sense to you guys. So that's kind of it for the content portion of it. I'm going to talk about a few other things. So find a stress coping mechanism. Here's why this is so important, guys. This sounds super fluffy, but there will be times when your stress is going to creep in. If you find out your results in 18 days or wherever it was, and you did not pass your written exam, nerves are going to be a factor when you're rewriting that written exam. I hate to say it, but if you have a fail under your belt, it's scary. That's why it's so important to try to pass on your first time if you can, because you're not having to deal with that stress component. All right. If you find out that you passed your written exam and you're going to take the practical, stress is going to come in. The practical exam is incredibly stressful. It is a very, very hard exam. Canadian students do so much better than international students in the practical exam. Okay. So you really, really, really need to be prepared. If we take a look at the University of Toronto last year, 10 of their students failed the exam. Okay, those are Canadian students. This is a very, very hard exam. The practical is difficult, okay? As I said with those donning and doffing techniques, there's little things you have to pay attention to in order to pass. This is a last hurdle you need to jump through before you are getting that certificate that says you're a physiotherapist, before you're getting paid like a physiotherapist. They make it hard, all right? So find a stress coping mechanism that works. Tapping is something that has worked really well for people. I won't go into it because I don't know it too well. Same as chanting, I don't know that. But breathing techniques, we all know that, okay? Breathing really helps to decrease cortisol in your body, to help you kind of think a lot. I was going to say think smoother, but think more cohesively, think more in a logical pattern. So really, really, really work on finding something that works for you, okay? The best way to find something that works for you is to practice it. You don't know what will work well in that situation, so pick one and really practice it. Before you start studying or before you go to bed at night, take 30 seconds. 30 seconds is all I'm asking you to do, and either work on deep breaths, tapping, or chanting, okay? These are invaluable techniques. This is more important than any course. Anything that you could do is find something that's going to help you decrease your stress. My next thing for you is start studying for your practical exams. Regardless of your score, regardless of if you are passing or not, studying for the practical exam is going to help you. It's either going to help you with the practical because you've passed, or it's going to help you with your written because it's going to give you a different way to process the information. So I wrote there, it allows your brain to process the information in a different learning style. It allows you to take it into a more practical or integrated way of memorizing it, which will help you in your written. Please, if there's anything you take from today, study in this next kind of few weeks like you passed, okay? Because any studying that you're doing in that time is not going to hurt you if you have to do your written again. Okay. Of course, it's really important. Register for a practical course. Again, if you do not fail, or sorry, if you do fail the written, none of that knowledge is going to waste. All right. So we're going to talk a little bit about scenarios. What if I fail? Okay. If you decide to register for one of our practical courses and you fail your written exam, you can transfer your registration to a written exam course or to the next practical course. Okay. So if you want to stay in the practical course, we have lots of people who do decide that they want to stay in the practical course. If that's too much for you, then you can transfer your registration to, again, a different written course or a different practical course. If you pass, yay, if you pass, let's all hope that we all pass, right? You want to determine which exam is best to take. So the next two upcoming exams are going to be July 2018 or the next exams are going to be November 2018 or June 2019. If you took the exam in March, May, or July, I highly suggest taking the November 2018 exam. And again, looking at what your results were in that poll, it does seem like a lot of you are planning on taking that exam. So really important, again, none of that information for the written is wasted. You need to make sure you have enough time and availability in your schedule to practice for that practical exam, but you don't want to have a long time in between doing your written and doing your practical. Then you're just losing all that great information you just learned. Start studying early, okay? Our courses start very soon. Our courses for the practical exam start in Vancouver. They start at the end of August. In Toronto and Ottawa, they start the first week of September. And our virtual courses for people who live in other places in Canada or internationally, they start the first week of September as well. So our courses those courses are made for people who are doing either the November 2018 exam or the June 2019 exam. If you're thinking about doing November 2019, wait till next year to take the course. But this course is specific for people who have done the March, May, July written exam and are going on to take the practical exam in either November or June. Now there's a sneaky exam coming up in September here. Now this is a tough one. If you are taking the September exam and you're wondering whether or not you should take the November practical, contact me. Let's talk about your specific situation. You know, it's a bit of a gamble because you are putting all this studying in and you don't find out your results until kind of right before the exam. For most people, it is completely worth it. As I said, start studying for the practical yesterday, even when you don't know your results, because it is so important to have that style of learning in your head. It's going to help you either way. Okay, you don't want to waste this time. But let me know and we can always chat. So here's the thing. If you do register for a course with us for the practical and you are wanting to potentially transfer to the written course if you do fail, just let us know and we will hold off sending you your notes. If we hold off sending you your notes, we can give you that transfer. If we give you your notes, you're registered in that course, and we unfortunately can't. As I said, though, it's really important to study for the practical regardless. So all those notes are really, really helpful. Our notes are long. For any of those people who are in our written course, you know we give you a lot of information, okay? So it's going to help structure your studying. But in the event that you fail, you can transfer your payment to another course, as we said, or you can transfer it to another student. If you find out that you pass, we will send you your notes immediately, all right? So last slide here, let me know how you do. When you get those results out in 18 days, you can email me personally at ptexamprep or info@ptexamprep.ca. If you have more questions or want me to talk specifically about your case, you can definitely email me. We'll set up a time to chat. You can visit us at ptprep.ca to see our course options. I'm giving you guys a coupon code. It's PASS in 2018. That'll give you $50 off your practical course, okay? So I'm gonna stop here. I'm gonna answer any questions that you guys do have. I will do my best to answer all the questions that you have, but yeah, thank you so much for joining me today. Again, just a reminder, the homework, you can email me and I will give you the answers. If you have questions, you can also email me. Other than that, thanks again for joining me. Okay, so one of the questions that I'm getting here is how much is the practical course? The practical course is 2,000 Canadian dollars. It is a 30-hour course of hands-on time or live time with your teacher. You also get unlimited support with your teacher, so you can ask any questions that you want. Our ratio in our live courses, so Vancouver, Ottawa, and Toronto, are 6 students to 1 teacher. Our ratio in our virtual courses online are 2 students to 1 teacher. So it's semi-private. So you're getting a lot of feedback in either of those courses. Okay. We'll wait to see if we have any more questions. How much does the written exam cost and when will it be in Toronto? So good question. All of our written exam courses are online purely because the exam is a computer-based exam. So we want you guys to be on your computer because we give you a ton of vignette style questions to go over, and we want you to be on your computer while you do these. So that course is as well 2,000 Canadian dollars. Now I'm not sure if you're asking me how much is the written exam to take. You'd have to look at the Alliance of Physiotherapy Regulators website, so the CAPR website. This will give you all that information. The next upcoming written exam is in September, and then November, and then March of 2019. Hopefully I answered that question okay for you. Is a practical course less expensive if you have to do the course virtually? No, a good question actually. So about 2 years ago, we did a retro study to see what our students or how our students did on the practical, whether or not they took the virtual or the face-to-face course. At that time, and then again, we did this study about 6 months ago, the pass rates were the same, whether you took it face-to-face or whether you took it virtually. Now, I think the reason for this is it is an entry-level exam, and you need to be able to be really good at talking, explaining, and being safe, and the frameworks to the questions. Your actual ability to do a grade 3, grade 4, mobilization, they're not testing that. They want to understand that you know why you're doing grade 3 or grade 4. They want to make sure that you have the joint in the open pack position. They want to understand that you know the open that you know the convex concave rule. So all of this really is involved in just understanding what you need to know. Of course, practicing on your own. So whether that be friends, if you have someone that you can practice on, whether it be a physiotherapist, sometimes they're really hard to find when you live in places like the Maritimes. But the biggest thing with this exam is being safe and understanding how to go through the questions. So whether or not you take it face-to-face or virtually, the pass rate doesn't change. We changed the ratio, so it's 6 to 1 in the face-to-face and 2 to 1 in the practical, or sorry, in the virtual. So long-winded answer for that. The courses are the same price. Okay, I'm just going through more questions. Is there any teacher assistant for the face-to-face practical course? No. So again, our ratio is 6 students to 1 teacher. So it's the lowest ratio of organized courses face-to-face. So we don't have a teacher assistant. We want to make sure that we are giving you the best that you can have. So we're giving you a physiotherapist with a really low group ratio. We didn't want to have 15, 20 students in a course with 1 physio and then some teaching aids. We wanted to make sure that every student is going to get the feedback that they need. Looking to see if there's any other questions. Looks like most of you guys have stuck around for this question period, so I'm really thankful to all of you guys that have hung out here. I'm not seeing any more questions come up. So, here we go. How are the notes provided for the practical online course? So we have an online classroom, and what happens with that is you will get access to it as soon as you have registered for the course. You have videos here, you have all your notes, you can download them if you like. So it's all on this online classroom portal that we have. We update the notes twice a year. So the reason why we don't print out the notes is because we are constantly changing that manual to provide you with the best and most up-to-date material. So we suggest that you just download the most recent version when you register for the course. Okay, this is a common question that I often get asked. Do we have a mock oski day? So in our practical course, our last session, session 10, is a review session. So what will happen is you are going to be told by your teacher stations that you need to work on, stations that you will not pass the way that you're going about them. So we're going to give you these things to work on. On that last day, you are going to go over those stations. We're going to go over any stations that we find that you found incredibly tricky. You let us know. We used to do a mock oski day, and we actually found that students much more preferred going over the feedback and the more intricate details of the question, because that's really what led to the pass. Okay. Sorry, this is a longer question, so I just need to open it up. Okay, what's the percentage pass rate of practical exam for PT exam prep and in the international trained PTs? So internationally trained PTs have different pass rates. The average pass rate, I think if we look at all internationally trained PTs, I'm talking too fast, is around 42%, so very low for people who are going on to take the practical exam. Our clinical exam pass rate with the course is 90%. That's very high, you guys. So 90%, we're taking people who generally are that 42% and giving you twice as likely chance of passing. So really, really strong course. Okay. This question, so does the course of the November practical exam start before the September written exam takes place? Yes, it does. So this is a tough question. This is why I said that September exam is something where, I'd like to talk with you if you're thinking about signing up for a practical course and you are doing the September exam. It is going to be case to case. For some people, the stress of studying for the practical in that shorter period of time is tough, because we do say, attend the course, attend your sessions for the practical, but don't really worry about studying for those practicals until you're done the exam. You're really only about, I think it's with the way that the courses start on the 7th or so of September, you're really only 10 days or so behind. But long-winded answer again, sorry, I feel like all your questions I'm taking a long-winded answer, but you really do want to chat with me first. I don't want to say your name, but we've chatted a little bit, and I don't think it'd be bad for you to do it. I think you're a student who would do well studying for the practical at the same time, but do know that it does start before. If you have any more specific questions about that, feel free to chat with me again. Sorry, I don't want to say your name, but I know who you are. Okay, how many places are still available for the practical? So we do have a few spots left. I think we have a few spots left in Vancouver, Ottawa. I think we only have 2 spots left in Toronto, and a few virtual spots left. We've released we've released all our practical courses now. So just a few days ago, they have all been released. Here's the issue, is that those exam marks are coming out in 18 days for the written, and the June practical is coming out in about 21 days. The countdown that the Alliance gives is often a few days kind of longer, so they usually get it a few days before this. Once those come out, our spots will be all gone. So if you know that you do want to take the course, I would highly suggest signing up now so that you can get the pick of the time that works for you. We sell out every single year. Our practical course is very hard to get into once those results do come out. Okay, how long do you think an international PT should prepare to take the practical? This is a tough question because every student is so different. If you have taken our written exam course, it's going to incredibly shorten the amount of time that you need to study for that practical. If you have not taken our if you have taken our written course, you're going to have less time. If you haven't taken our written course, it's going to take you longer. If you take our practical course, it's going to take you even less time. If you haven't taken the practical, it's going to take you a long time. So if you haven't taken the practical course from us or the written course from us and you've passed your written, I would strongly suggest 9 months of studying. Okay, I'm going to say 6 to 9 months because some students do have time off and it's easier for them. If you've taken the written exam from us, if you've taken the practical exam from us, you're looking at about 2 to 3 months of studying. No problem. Are there any classes in Alberta? Great question. For the June 2019 course, we will be in Alberta. If you would like to get on the wait list for that, because we actually have quite a few students on our wait list already, you can just go to our website, go to waitlist, or just email me info@ptexamprep.ca. We'll put you on the wait list and we'll let you know as soon as we release those dates for 2019. How much studying should we allot for the PCE practical? I suggest that you want to be studying. Again, it really depends. If you've taken our course, if you've taken our written and you've taken our practical course, you're looking at about studying for 2 to 3 months. The first month can be a little bit slower, just getting into it. Those next 2 months, you want to be studying around, 7 to 8 hours per day in those last 2 months. So it looks like a few of you guys are asking for the link to the wait list for Alberta. I have a ton of you guys asking that. So I'm just going to pull it up here. Bear with me for one moment. Sorry, just opening it up. Okay, so I'm going to post this link in the chat. Can you guys see that come up there? It should just pop up onto your screen into the announcements. I'll also answer one person's question. Oh, no, sorry, it's just going to be in the announcements. Again, if you guys have any questions, please just email me. Otherwise, I've posted the waitlist in the announcements. It's www.ptprep.ca/waitlist. Okay. Keep going through these questions. What is the easiest way to sign up for the practical? I already did the written test. So the easiest way to sign up for the practical is to go to our website, to go to courses and practical exam. You will then from there see all of the courses that we have available. So if you're wanting the live, virtual, you'll see if you want the face-to-face, you'll see all the different options. I'll again post this link in the course announcements, or sorry, in the announcements here. And I will try to answer this question here so that everyone can see that as well. Okay. Do you think it is a good idea to get an interim license while studying for the practical? Good question. It depends, I'm going to say. The reason why I'm saying it depends is if you have taken a long time in between your written to your practical, yes, very important. Get your interim license. You mine as well. Okay. It allows you to still practice your skills and study at the same time. If you're taking the July exam or the September exam, and then you're going to plan on taking a very close practical, so for example, the November exam, I don't think there's really too much of a need. However, and this is a big however, after you are done your practical exam, there's about 12 weeks until your results come out. If you have applied for your interim license, you then can work at that time. So to take this question almost to another level, I would say that in between your written and practical time, I think your best bet is to start studying for that practical. Afterwards, yeah, after you've done your exam, there's not really too much you can be doing. I would be working on an interim license. Why not? All right. Okay, so I just had someone ask me that they've missed the webinar because they had to work. They didn't think it was going to be so busy. Are we able to send out a recording of this? It usually takes us a few days to go through and tidy it up and edit it out. But if you want to send us an email, just to info@ptexamprep.ca, then I will send it to you once it's ready. So I'm just going to type that in. Send. Okay, how are we doing here? Answered that, answered that. Okay, any other questions, guys? I'm going to give you just a few more minutes and then I will close this down. Okay, one more question I've got. Is it worth working while doing the practical course? Again, good question. It really depends. If you are someone who's had some time to study, so meaning maybe you've been studying since July or you've been studying since May, then yeah, I would work while doing the practical course. If you are someone who, just finished studying in July and you haven't really started yet, and you're thinking about taking the November exam, I don't think I would work if I were you. I would just focus on studying for this exam. Once you have finished this exam, again, you're a physio, you're getting paid the big bucks. It's a wonderful career to have. So I don't think it's necessarily worth kind of putting away in the interim. But then again, I do think it's important to get your interim license so you can work after you've done the exam. I hope that answers that question. I've heard great things about your practical course. I really want to take it. How do I register? So I'm going to send this link again here. So that is the link to the practical course. You can click there. Okay, last few minutes here. I want to respect your guys' time and be done here by 1 o'clock. So again, send me any emails, questions that you have. When you do exit this webinar, you will be prompted to do a survey. It's just going to ask you guys, for my sake, how did it go? Do you have any questions? Are you happy with how this information went? Other than that, I'm going to close it down now. So thank you again so much. I hope you guys have a great rest of your Monday. Happy studying.